I'm Melissa Candle. I'm the Clinical Services Coordinator for Occupational Therapy at Duke University Hospital. The first thing that is important to know is that occupational therapy will come to see you on the day of your surgery if you're having a total hip arthroplasty. The reason being is we would like for you to start to get moving. We'll also teach you about your adaptive equipment so that you can begin to work towards being independent with your bathing and dressing. Oftentimes we work alongside a physical therapist, and so the both of us will come and see you on the day of surgery just to start getting you to the edge of the bed, maybe standing if you can tolerate it, taking a few steps and educating you on the process of your recovery. Our primary goals for occupational therapy are to help you to become independent with your self-care. When I say self-care, I mean your bathing, dressing, getting to the bathroom, getting in and out of the shower and the tub. We'll also instruct you on how to use adaptive equipment to help you maintain your precautions after surgery while performing your self-care, particularly your lower body bathing and dressing. In addition, we'll give you instruction on equipment needs that you may have. Oftentimes, you will need a bedside commode to put over your toilet at home or even at your bedside, depending on how well you're moving. It can also be utilized as a shower chair if you have a walk-in shower. If you do not have a walk-in shower and it's a tub shower, then you may need to find a tub transfer bench or a tub bench that you can sit inside your tub because the bedside commode is often too large to fit inside a tub shower. And lastly, we'll discuss with you your discharge recommendations. So occupational therapy, along with your case manager and your physical therapist, will work along with your physician and yourself to determine the safest and most effective placement for you after your surgery. And so we will discuss with you what your plans were perhaps going into the surgery, if you wanted to go home with home health care or home with outpatient therapy. We work with you to achieve that plan. There are times when that plan needs to be altered if perhaps when you're recovering, you maybe aren't moving as well as expected, or maybe you don't have the family support once you go home that you thought you were going to be able to have. But the most important thing is that we find the best discharge plan for you where you're going to recover well and have the least amount of discomfort. So I wanted to talk to you about precautions that you're going to have after total hip arthroplasty. First of all, there are two types of precautions. You have anterior precautions and posterior precautions. And you will know after surgery, there will be many people that will tell you about your precautions. So you don't have to worry about knowing which set of precautions you will have to follow. We will definitely make sure you know that before you leave the hospital. The first type of precaution I'm going to talk to you about are the posterior precautions. And with the posterior precautions, we don't want you bending at your waist, and we don't want your operative hip to bend past 90 degrees. So the way that you can think about that is you don't want your knee to be higher than your hip. So when you're sitting on the commode or you're sitting in a chair, you want to make sure that the commode or the chair are tall enough that your knee is below your hip. We don't want you to cross your legs and also turn your operational leg inward while walking or laying in bed. And as you can imagine, because you can't bend your hip past 90 degrees, it's going to be very difficult to get your socks and shoes on, to wash your leg, to get your pants on. And that is why it's so important that you are educated on the use of this equipment to maintain these precautions, which will last from anywhere from 6 to 8 weeks. The other set of precautions are the anterior hip precautions. With anterior hip precautions, you don't want to extend your operational leg behind you, and also don't want to cross your legs or turn your operative leg outward. So the anterior precautions are a little less restrictive, but still limit you in making it a little more challenging to be able to do your self-care. So we'll educate you on how to perform those activities of daily living within the context of your precautions safely, because 6 to 8 weeks is a long time, so you're going to want to be independent within that period of time, and we will help you do that.